Hi, at a recent ICB board meeting, the first I've been able to attend since COVID, I was fortunate enough to be able to ask the question of the Integrated Care Board, and the question I wished to put to them was what support is currently being given to doctors' surgeries, particularly in areas where there is a massive amount of building going on, to meet or to continue to meet the needs of their existing patients and equally important joining patients. This was the sort of response I got, and let's hope that there will be some meaningful support coming forward. Have a look. What we came to discuss today really was I live in a seaside town which just before COVID had one of the 4 surgeries that it had closed down because of the inability to find staff. Since that time, the number of dwellings that are being built in our town is somewhere in excess of 4,000. That's of a population currently that's housed in just over 11,000 dwellings. I'm a member of my PPG of my surgery, and we recently had a meeting at which we asked what progress was being made on being able to meet the demand of an additional 10,000 people. And our partner doctor said that they had plans and they'd gone forward, and they were told that the NHS was not prepared to guarantee the loan to enable the building and the expansion, so that the service that I'm getting and future prospective patients would get would be able to be met and funded. Can you explain why the SIL that is taken from developers, etc., isn't able to be utilised straightforwardly to meet the demands that they will be putting on the existing primary care services?
Okay.
Just a simple question.
Yes, it might not be a simple answer, and it may be something that we have to answer in slower time. But
I'll follow Frida.
you over to Frida first, then.
Yeah, I had a similar experience in my practice where we wanted to develop, because we've got also our village is growing and growing and growing, and we put forward. We own out. We're a practice owning. We own, the partners own the building, and we had a developer. So very similar to what you're describing in Felixstowe, and what happened was we have a market surveyor, basically a valuer who NHS anoints or whatever, and they come across and they tell us exactly what our practice is worth to the NHS in rentable value. So basically the NHS rent our property that we own for a certain amount of money. Now when the developer comes along and he builds a £2 million building or extends for £1 million or whatever it is, he will have different expectations to what the valuer will have. So the problem is that whilst our value for our properties as it stands at the moment is acceptable to the NHS and they pay us that rent, cost rent, when a new building is made, or our notional rent, when a new building is made and it's cost rent, then the developer will ask perhaps a lot more. So we would perhaps we rent it for 50,000, say, approximate, but the developer may build such a building that he wants a return of about 200,000. And that kind of conflict is what is prohibitive in terms of primary care development, estate development. Because whilst we go to developers, and we then become tenants essentially and no longer owners on a lease, the point is that the difference between what we at the moment with not fit for purpose premises are being paid is far less than what these new beautiful developments will cost if the NHS agree to do that. And unfortunately the money isn't in the system to pay the developers what they want and probably need to cost their own outgoings, and yet we're much cheaper basically. And that's the conflict a lot of primary care, particularly partnership owning properties, are having in terms of development. Does that all make sense?
Yes, very helpful.
Yeah, I hear your answer, but in our situation, the building is brand new. They're looking to extend the existing building, no single development is looking to provide a surgery at all, but there is still money, and that is money that the local authority has and charges the developer, that should be available to provide primary care health, or at least it should make a contribution, and that apparently isn't happening. So you are responsible as a board for care in the community, and it strikes me that if the GPs aren't being supported to have adequate surgery space for a known 10,000 extra population, that really is a major failing of the whole system.
So let me just hold you there, Michael and Frida. Good points that you're raising, but the but I've got here is how do we deal with it now, and also the questions should really be exactly on agenda items. So the way we, I think, should be dealing with this is perhaps to take Michael's points and actually answer in a slower speed. I don't mean slow, but in a written way, and we can add a written answer to Michael's question to the minutes, which will go on the website. But let me go to Ed to see if you can make sense of that as an approach, Ed.
I'll bring in Peter in a second, but we now have 3 alliance directors within our board here, and Maddie Baker-Woods is the one that covers Felixstowe, which you're referring to, if I can work it out. And those directors are now roles working in collaboration with the local authorities as well as the NHS. And part of the work that Peter, I'm sure, will touch upon now is we're thinking about primary care provision, looking at the growth of population, but also the growth of roles in primary care. And we haven't necessarily got the accommodation to accommodate everyone. So we've got a real issue. So I think we absolutely recognise it. I'll ask Maddie to follow up with you specifically on the Grove, and Peter, you may want to add your perspective.
Go on, Peter.
Thanks. Yeah, I'd probably said something similar. What would I wish Maddie would say if I wasn't here, so to speak, on our behalf? I think it's 2 follow-ups. There is a specific response to the Felixstowe circumstances, but I think this has a much wider, SNE-wide national issue. That if we have this massive ambition for left shift, and we've got growing populations that are not evenly distributed, so this falls differentially, and that lease story is one that is told many times around SNE. So I think there is a strategic theme for us to return to as a board, because it's a major strategic issue. We're going to need to find a way through. So I think there's a suggestion, as you've said, there are two courses, 2 things to follow up to bring back as a future item.
Great. So we'll deal with that as a written response. Thank you very, very much, Michael. Thank you. Okay, everybody. So 10 to 5, we've dealt with the entire agenda. I think we can close the meeting as of now. This meeting, we do have I hope, a very, very short part 2 meeting to follow. But shall we have a 2-minute break if we can, and then we'll reconvene in private session. Okay, thanks very much, everybody. Thank you.
Okay, folks, well, there you heard 3 members of the Integrated Care Board endeavour to answer the question or the problem I pose, which is basically, how is the CIL, which is the Community Infrastructure Levy, and this is a payment that's made by the developer for each dwelling that is erected in his scheme, and that money is supposed to go towards health, it's supposed to go towards education, it's supposed to go to, and it varies depending on which part of the district you live in, and possibly one of the reasons we've got such a high rate of building here in Felixstowe is our CIL is a very low figure. Perhaps that's why we're getting very little help in delivering community infrastructure projects. So the answers I got from the 3 members of the board didn't really directly address my issue, which is the CIL, how's it used, and if it's not the CIL, is it the NHS, and how does the whole system work, and why isn't it working for our community, and particularly you, an existing patient of surgeries in and around the peninsula. This growth of 10,000 probable new patients, how, without suitable and sensible expansion, are they going to be able to meet your and your family's needs, as well as the new needs of the new residents on the peninsula? Thank you very much. We'll keep you updated as and when we know more on this particular subject. Bye for now.